Rivera.
Hello.
You remember me?
I do.
Good.
You were my nurse last night.
Yeah. Well, I came to talk to you today because my understanding is you were having some palpitations. That's what brought you
Yeah.
in. And the doctors did a procedure on you, an ablation. And so even after that, you're still having some dysrhythmias and things like that. So they want to do implant something like a pacemaker. You've heard of a pacemaker before?
I have, but what does it do?
The pacemaker regulates your rhythm of your heart. So it actually makes the pace for your heart.
Ooh, that sounds scary.
It is kind of scary,
Are they
but
safe?
they are safe. I will tell you a little bit more about them because you're not getting a pacemaker, you're getting an intracardiac defibrillator.
Okay.
And so when I tell people about these, I tell them it's like fingers and thumbs. Like a thumb is a finger, but a finger doesn't necessarily mean it's a thumb. And so what I mean by that is like intracardiac defibrillators are pacemakers as well, but pacemakers are not intracardiac defibrillators. Okay. So the difference is that they do share some attributes, the pacemaker and the defibrillator. They do share some attributes, but the defibrillator has the capacity to actually shock your heart back into rhythm. So it's going to sense your heart rhythm, and if your heart is doing something that's dangerous, that's going to make you pass out, or that's not healthy for you, it can be programmed per your doctor, per your cardiologist, and that way it can actually deliver a prescribed dose of electric shock that will set your heart back into a rhythm that's healthy.
That sounds really scary.
I
Will
know.
it hurt when I get shocked?
So it does. It does hurt a little bit, and actually, what you'll end up doing is the defibrillator will set off an alarm letting you know it's about to shock you, and you need to get to sitting down or laying down right away. You need to get to sitting down or laying down because a lot of times that electric shock might knock you out. You know, it might knock you out. So it might not be so painful, but it will definitely, take you out of perspective for a minute. So, but yeah, the purpose of this shock is to reset the dysrhythmia of your heart that you were having, which is, why we did the ablation and everything, okay? It's to put you back into normal sinus rhythm. That's what we're looking for.
So like a regular heartbeat again?
A regular heartbeat. This implantation of the intracardiac defibrillator is minimally invasive. It takes about 30 to 45 minutes. Typically, they're placed on your left side of your chest, of your upper chest. This is the preferred area. I suspect this is the area that your doctor will be using.
Yeah, he talked about using my left, but if there's a complication, he could do it on the right,
he could do it on the right. And even in addition to that, some of the other locations they can go into the abdomen in a subcutaneous area. So that's not completely out of the question either. That would be a different planning. And so if we couldn't get it on the right or the left today, we would bring you back to do subcutaneous because that's a different setup and that's a different device. Okay.
I'm glad there's options.
Yeah, definitely got some options for you. We will do this under the guidance of radiation or fluoroscopy as it's called, and the doctor will locate the vein, the subclavian vein, and he'll go right through there using a teeny tiny micro wire. So he'll put a little bitty needle in there, will get you cleaned off and numbed up before. Anesthesia will be in the room to make sure that you're sedated appropriately. So you shouldn't feel any pain during this. If you feel any pain during this, because you will not be completely asleep, but if you feel any pain, definitely let us know. We'll pause for a minute. We'll put more lidocaine in there, which is a numbing medicine directly in the skin, and the anesthesia can adjust your level of anesthetic. Okay, so you should not be in any pain during this. So hopefully
really
that,
good to know.
yeah,
That's
hopefully
one thing I was
that'll.
worried about.
Everybody's pain level is so different, so we don't want you to be in any pain. So don't be scared about that, okay? But once the doctor puts that little bitty needle in there and gets access to your subclavian artery, we will then go with a little micro wire, your subclavian vein. We'll go through a little micro wire, and then we'll take that all the way down to your heart, the superior vena cava of your heart. And so with the micro wire in place, we'll go over that micro wire using that as a guide, and we'll put a sheath on there. We'll pull out that micro wire, and through that sheath, we're gonna put the actual coil. It's a coil that will go into your heart, okay? And that coil looks a little bit like this. And actually, the tip of the coil resembles like a screw that goes in there. So if you can see that, it looks like a
I
corkscrew
do. Wow.
on
So
there.
that's gonna like just go into my tissue and hold it in place. Huh?
Yeah, so it goes right into the muscle in between your hearts, which is called your interventricular septum. Okay,
Okay.
and so this coil is placed right into there. If they did place another coil in your right atrium, then this would also be for pacing your heart. But
Okay.
that's not what we're wanting to make sure they can place it in there. So we'll probably do 2 coils for you, one for pacing your heart and one in the ventricle so that we can shock your heart.
Okay.
Okay. So we went over the locations of them. Also, let's talk about some potential risks. I will go ahead and tell you the risks are very, very minimal and happen less than 95% of the time. But anytime we go into your skin for any reason whatsoever, there's always the risk of infection, okay? So you should be aware of that. If you have any what we call comorbidities, like if you had high blood pressure or a recent infection or anything like that, the doctor will go ahead and start you on an antibiotic before we even get started. So anesthesia will give you that antibiotic before we even get started. One of the other potential risk of this is what we call like a lead migration. That's when that coil is supposed to be in the septum of your heart, but depending on your aftercare, because I'm going to tell you in a minute, you're going to want to hold that real still, that arm. But if anything should happen where it gets dislodged, then we would perform like a device function test, bring you in, we'll check with x-ray to see if it's in place, and then if not, we'll go from there. But so that is a potential, doesn't happen often. As long as you follow your aftercare, you should be good, okay? Let's talk about your aftercare. It should be, you're gonna have like temporary limited mobility on this side, okay? So if we're going on the left side,
so they don't want me to.
They don't want you to move your arm very much. You're gonna act like your arm is broken, is how you'll act.
How long do I have to be like that?
So we'll do that for a few weeks. The purpose of that is so that that coil can settle into the heart and create some tissue around it. Well, it'll be freshly screwed into that muscle, and we wanna make sure that it's good and embedded before you get.
That makes sense.
Yeah.
Well, I'll be sure to follow those directions.
Yeah, absolutely. Also, you're going to keep the site clean and dry, okay? They're going to put a bandage on there and you'll leave that on for a few days. But if you notice any fever or any irritation at that site, definitely let your healthcare provider know, let your doctor know, okay? This is just an example of what you can expect in your skin. It's just a tiny little scar right there. Most people don't even notice it, but you will see that little bit of bulge because it's not very deep. It's just under the first layer of skin, okay? So that's what we've got to go over for you. Do you have any additional questions? I'm gonna leave this with you.
Okay, thank you. No, you covered all the main points. I feel it made it sound really safe.
Awesome. Well, I'll be there with you the whole time, okay? And so if anything comes up, just let me know.
All right, I will. Thank you very much, Stefan.
It was my pleasure, Dan.